in. I see more are in now. Good work. All right. I'm Lyle Hanna, your host today, and we're delighted you're here to join us for the 43rd Crisis Management for COVID-19. You know, we're kind of doing these week by week, and boy, so much stuff happened last week. We thought we need to go do something, and particularly we've added to it this $1 trillion infrastructure bill. So Jim's going to give us, we got some people to talk about what's going on with COVID, because a lot has changed in the past 2 weeks, and then also some information on this infrastructure bill. I think you'll find it all very interesting, and we're just delighted you're here to join us. I see people keep trickling in. That's great. We had about 140 sign up, so I'm sure some more will be joining us. We also have some special guests. I tell you what, I'm going to flip to the next slide. We're going to introduce some people. While we're doing that, we're going to give you some questions to answer, because these polls help us kind of make sure we're targeting things that are important to you and make it realistic. So can we put the polls up? Here we go. As you're doing that, I'll just tell you about what our plan is for today. But gosh, I got to fill this out too. Whoa. Anyway, we're glad you're getting a chance to do this, and we appreciate your feedback. And you know what? We don't go look at who says what. We keep that kind of off. We just don't do that. But so I'm going to share with you some things that are current about COVID. We've got some videos to share with you, because Johnny C. Taylor is kind of all over the place right now. He's the head of SHRM. He's going to be speaking at the SHRM conference in Kentucky in a couple of weeks. We have some people speaking at the Tennessee conference today. Angie Bailey and Sonia Osmond are both down there speaking, and Johnny Taylor was down there today. But he's made some strong comments about vaccines, so we're going to share that with you. We also got Joe Bon Jovi here with us, and Joe is the head of HR for Sazerac, which Sazerac is one of the top 10 largest producers of spirits in the world. So not just are they big in Kentucky, because I know you've all heard of Buffalo Trace and Pappy Van Winkle and Barton and so many others. But I don't think I asked him to provide samples, but he has not come through with that yet. So we hope that he, figures out how to do that. Anyway, try to get your survey done and submit that to us. That would be great. And let me see. I think mine won't go away unless I do something with it. So I guess I better answer these real fast. All right. See if it'll go away now. Still won't submit.
You have to answer all 6.
I'm trying to get it.
No, I didn't put this together, so if you're yelling about that, I didn't do it.
I'm not yelling about it.
No, I wasn't meaning you. I was meaning the people trying to answer them.
Yeah. Okay. Tough questions. All right. And everybody might have all the answers. But anyway, so you know what we're going to cover today? Let's get on with it.
All right.
This next slide, we got I don't know if everybody else has had time to do their questionnaire. I hope you have. We appreciate that. Yeah, okay, I'm going to kick it off, and I'm going to talk about kind of what's going on. Gee whiz. What we're hearing is, what should we do? And I can tell you this, most people are trying to take a wait and see attitude. Some are jumping right in, and the ones that are jumping in are trying to take it piece by piece. So there are quite a few people in Kentucky that are mandating vaccines, and we'll share a little bit more about that with you as we go along. Some of them, then, if you're doing that, they're having a signed document, or, because if you have religious reasons or medical reasons, you need an exception. They're asking that to be signed. They're saying you must wear masks indoors if you're not vaccinated. Must show a negative. If you're not vaccinated, if you can't do it or not going to do it, you got to show a negative test results weekly. Or some of them are even doing it every 72 hours. So pretty, sort of extreme steps by some people. The masks are optional in small group areas with consensus. So what employers are telling me is, if you're in this group and there are just 5 of you in the office, then they talk it over. Are they comfortable? If everybody's comfortable, everybody feels protected, then they take their mask off. But when they're in larger group settings in the workplace, they're mandating masks. Vaccinated employees must closely watch their own symptoms, because you could get vaccinated and still bring symptoms into the workplace. So they need to watch them closely and take proper precautions. If you are symptomatic, stay home. Don't come to the workplace. Everybody's pretty clear about that one. A lot of things going on, and we're going to share some other examples with you. Let's flip to that next slide. And I think we've got a video too.
Source management, Johnny Taylor, told me most employees, they want vaccine mandates.
There are some organizations that are trying one more step. They're saying if you choose to be vaccinated, then you will have to be tested several times during the week on your own dime, and you have to wear a mask in the workplace, and not any mask, but that N95 surgical mask. I mean, we are going to, at the end of the day, make this uncomfortable for you because we make it comfortable and the workplace less comfortable for your colleagues.
All right, let's hold off on that next one just for a minute. I don't know if you could hear that. It was really clear yesterday when we ran this. So that's the president of SHRM talking, and he's saying some people are taking some pretty strong steps, and they're just trying to figure out how do we get more people vaccinated because they know that will make a difference. And it certainly makes other people in the workplace feel safer if they feel like everybody they're around has had the vaccine. There's far less chance they will be, passing it on to you. So there's a little bit more here about what some other companies are doing. Jim, you want to run this second video?
Yeah, let me see. I don't know why that sound didn't come in. Let's see if this is better.
Amazon just announced that it will delay its employees' return to the office until 2022. 2022. The company is not the first major.
All right, this is not going to work very well, so let's just skip that and not put.
I apologize.
That's okay, through the torture of it. Basically what he's saying is that in addition to vaccines, other thing that's changing rapidly is when people come back to work. And, we know this because we run HR for a bunch of companies, and we've got employees saying, no, I'm not coming back to work. We have people that are taking their children out of school right now because they just think it's better to wait a month. Even if they miss a month, it's better to be safe and not get COVID. So a lot of things are going on that are driving behavior. So let's look at the polls. Here we go. What works best to encourage people to get the vaccine, rewards or penalties? And it looks like rewards by a long shot, 83%. Good, that's what we found too, but we wanted to share that. Okay, is your workplace currently mandating the vaccine in order to return to work? Right now, hardly any, 8% on this call. So that's really interesting. Okay, I know that people are considering it though. Number 3. All right, number 3, I can't get it to sit still. If yes, are employees who are able to be vaccinated, are unable to be vaccinated due to medical or religious reasons, allowed to work in the office? And the ones that said yes, I guess that 8%, they are able to come in, and maybe this is just everybody said this, that 21%, if you're not able to get vaccinated, you can still come in and you can work in the office, you can wear a mask. And that's kind of what we're doing too. Number 4, if you mandate the vaccine, how are you handling employees who refuse to get the vaccine for non-protected reasons? And so few of us did that, only 8%. So we don't really have much data here, but requiring to wear the mask if you come in the office, separate them from employment. 2%. Well, golly, that's interesting. So of that 8%, 2% or something are saying they're going to separate them if they don't do it. So that's a big deal. Not many people are doing that right now, but it might be the way to go. And then, so just masks in general. Is your workplace currently mandating that employees wear masks? 33% say no. If they're not vaccinated, 23%. Let's see. Yes, but only in a meeting. So nobody said that. Yes, but only in public spaces. So that's more like that thing I said. If you're going to be in groups, you need to do it. But if you're just in the office, like in your own office or something, not an issue. And then 10%.
They're going to have some changes to their policies when we get done today. I'll just let you know that.
Yeah. Okay. That's good. That's why I want to prep for this. see how many people are going to be pushing back. If your workplace is encouraging but
Today,
not
you-
requiring the vaccine, what are you offering to your workforce, if anything? So rewards for getting vaccinated, 23% are already doing that. Wow. Penalties for not getting it, hardly anybody. Education for all, 15%. And nothing, not publicizing or rewarding, 60%. So 60% of us are still on the fence. So let's listen to what we can learn today. Let's hear from some other folks about what they're doing. I asked Joe Bon Jovi to join us. I mentioned that he's the head of HR at Sazerac. Kind of cool. You know what? He used to be the head of HR for all of Marsh & McLennan, which is Mercer, and other companies. So he's had a lot of great jobs in his career. We're delighted he's here. Now he's living in Kentucky. And Joe, you've got a lot of different employees doing different things. Tell us what you guys are doing about it.
I'll have you jump in. I do want to clarify one thing. Thanks for the promotion, but I was not the head of HR for all of Marsh & McLennan. I was the head of HR for Marsh North America.
Oh, shoot. Okay. Well,
yeah.
Here, I have such praise for you that it's overwhelming. All right.
Thanks. I really appreciate that. I don't want to have any fake news coming out of this session, but thanks for having me on. Like everyone else on this call, we've been obviously very focused on this. And I think right off the bat, one thing I want to say is that our workforce is highly segmented, so we are not able to follow one singular approach across the board. We have U.S. plants, Canadian plants, U.S. commercial operations. We have a Louisville office, visitor centers, and we also have many global locations. So we have to be sensitive to all that. But I do want to talk sort of at a high level what we've been doing mostly in North America. So I think that's probably what's most relevant to the folks on this call. And I will mention some interesting things that are going on outside of the United States. So in general, we have decided to follow CDC guidelines, with the one exception is we've moved slowly to implement the new guidelines of having people masked up indoors, whether they're vaccinated or not. That's been some debate for us, and I'm happy to go into the details of why that's a debate. Mostly it comes down to we really don't want to disincent people who have either gotten vaccinated or we want to get vaccinated. We want them to be able to be face covering free. And I realize that we may not have a choice here soon enough with the new Osha guidelines, but that's the only CDC guidelines that we've been hesitant to move forward on so far. We did go to face coverings for unvaccinated only when the CDC guidelines came into place. And we had a long debate and ultimately decided that we absolutely wanted to require people who are going to claim that privilege to have to upload their proof of vaccination cards into Dayforce so that we had that readily at hand and we could validate it very quickly. And that decision, although controversial at some level, has been validated over and over again because we can immediately tell whether somebody's been vaccinated and under which vaccine that they were utilizing. And then we use visual markers for people too. So if you were without a face covering, you should have had a visual marker, either something on your badge if you had a badge, or a wrist indicator like we use at Buffalo Trace. You're familiar if you've been there visiting, that you get one of those wrist indicators to allow you to be without face coverings. We also have been very consistent in following local protocols. So even though I just gave you a general rule, our folks in Canada, in Quebec and Ontario have never come off of face coverings. And our folks in Carson, California, and in New Orleans, unfortunately, had to go back into face coverings because of local requirements. We are not currently mandating vaccination, and I don't think we're going to get there. However, we do strongly encourage and recommend people to get vaccinated. We've done a lot of educational events, and like many of you, we've brought vaccine clinics on site. Our India operation, which is our second largest outside of the United States, has literally brought, they call them a camp. They brought vaccine camps into the workplace, and they've been pushing people through the vaccination. Overall, we're only about 35 to 40% vaccinated across the board, but our India operations, which has about 1,800 people in it, is 91% vaccinated. So that's been a real success story. But you also have to remember, This is where Delta variant came from. So people are highly, highly motivated in India to get vaccinated. And we sprung for the cost. They don't get it free in India like we do in the United States. So our business sprung for the cost of paying for everyone to be able to get vaccinated over there. And we used our logistics and supply chain capability to get it to folks. So they're greatly appreciated. And I do remind people here, when they're debating whether to get vaccinated or not, how grateful people are outside of the United States to even be able to get access to it, much less vaccinated. We have not yet required a negative piece. So it's interesting to hear Johnny Taylor talk about the disincentives for remaining unvaccinated. And we have not yet gone down the path of requiring a negative PCR test to come to work, but that is in debate right now. And if things get worse, we may very well go down that path. We did a pilot on incentives in 2 of our smaller locations early on when vaccination first became available more broadly to all age groups, all working age groups. And what we learned from those was that individual incentives don't work. You just end up paying people who are going to get vaccinated anyhow, and you don't really change behavior for those who are not. We are currently debating, and I learned this last week on a couple of calls that I was on, both on the NAM call and it might have been the Greater Louisville Inc. call, that some employers are experimenting with team-based incentives. So if your location gets above a certain vaccine level, say 75%, just for sake of argument, then everyone who is vaccinated at that location is going to get an incentive of X amount. So we are talking about doing that, and we do have some enthusiasm for that approach. Symptomatic individuals must still stay home, even if they're vaccinated. And then last but not least, I'll mention the Louisville office. We had gotten back up to about 50% capacity, so we moved relatively quickly to bring people back after the CDC changed their mask guidelines. We've paused at 50%, and we'll revisit that based on the current circumstances. We do have one building here that's vaccination only. So if you're going to come into that building, then that's you have to be vaccinated and everybody's face covering free as a result of that. So at a high level, those are the things we're doing. Probably a lot of things that you're doing. We've learned a lot from others as we've gone down this path. But that's a high level summary of where we are, Lyle.
Wow, great, Joe. Those are some great ideas. Thank you very much for sharing that. And I'm going to continue to buffet your resume as I recommend you speak to other groups, okay?
Excellent.
I don't see any questions that have popped up. Allison, anybody? So Joe, if you can hang with us, we'd love it. And sure. But if you need to get back to work, I mean, some Blantons would be good. You know, I know somebody has to be making that stuff. So
correct.
But get people back to work over there. Thanks a lot, Joe.
Thank you, Lyle. Cheers.
And you know what? Our next guest is, it's funny, we've got, some of you know Alden Pennington. He's had some big jobs around Kentucky. He's head of one of the largest dental practices in the United States right now with over 3,000 employees and what is it, 175 different offices or something like that. But he couldn't, last minute, he couldn't join us. So John Coffey, who works for us, who runs all of his recruiting nationwide, is going to step in and share some comments with you on what's going on there. Because what I tried to do is get some organizations that are, you know, multi-complex. You know, he's got an office, he's got a headquarters, he's got all these little offices around. John, why don't you tell us what's going on at Benevis?
Yeah, I'd be happy to. So Benevis is, they were founded in 2002, so they're coming up on being 20 years old. So what they are is they're a dental support organization, or we call that a DSO. So they do have 3,000 plus headcount across the United States. They're based out of Atlanta, and they have over 160 offices in 17 states. Primarily as an organization, Benevis is focused on providing children's dental services, about 90%. They have about 10% on affiliate, which would be adult facing. But they service in underserved communities, and they actually see about 2 million patients a year. So really what Alden's provided based on the executive ethos is sort of the 1,000-foot view. So on their approach to COVID, what they really wanted to do is accomplish 2 things: try to avoid or delay a mandate to vaccinate as much as possible, even though it might be inevitable. And then the second point was to really put in place a robust process for any exposure, both employee, patient, inclusive of contact tracing. So from there, they kind of devised a internal corporate philosophy on what that narrative needed to look like. Now, Benevis has a headquarters operation, of course, and then their offices. Those offices are based underneath sub-brands under the Benevis moniker. So in different regions, we could have Franklin Dental or Candler Dental. We used to be branded as Cole Smiles in certain areas, but this would be sort of a dual-fold approach to how do we handle it at headquarters, how do we handle it at those different office locations as a standardized mechanism. So the general narrative for healthcare in particular is that we're really duty bound to protect and care for the patients. The organizational stance was that it's morally objectionable not to be vaccinated and then to give vaccinations or provide care for those infected. So in fact, organizational citizens were the expectation internally at Benevis is that we expect people to look out for each other, and this pandemic is highlighting that need. So the organization has already gone through a bankruptcy due to COVID. It's springboarded, rebounded back, and thus doing phenomenally at this point. But with the spike in cases more recently, we've had to shut down multiple offices due to those outbreaks. So these outbreaks were caused by unvaccinated staff every time, leading to lost wages, patients not getting care, and then ultimately the company not losing revenue. So for now, and this continues to get revisited and stay top of mind to the executive HR team, but the current policy is that unvaccinated must wear a mask at all times, period. Vaccinated at the headquarters office in Atlanta, which really is a small dose of the population of, the 3,000 plus folks, just a few hundred, really not required to wear a mask at the corporate office, but still at any of our dental offices, period, required to wear a mask, period. And we're not asking for proof of vaccines at any time, except when there is an exposure that's highlighted. And then, we're asking sort of as a way to review for contact tracing at this point. So that's kind of the high level. Again, just constantly top of mind, CEO super tied into this, and the rest of the C-suite, and just continues to be a constantly revisited and communicated piece.
Got it. John, thank you very much for sharing that. And just wanted to give people a flavor of what's going on out there. Before we move on to our next topic, I want to just say there's another little thing that's going on. Some of you heard of Railbird. It's a huge concert that goes on in Lexington. It's coming up in a few weeks. 32,000 people coming from all across the country. All their tickets are sold out weeks and weeks ago. And they just put out an announcement that says you can't get in unless you've either been vaccinated or you show the test results that you've had a negative test in the last 72 hours. And they're going to have, people checking that at the gate. So, some pretty strong, and by the way, it's an outdoor concert. So, but, pretty strong steps to try to make people feel comfortable and safe at these kind of things. You would hate to have a major outbreak come out of something like that. So just another example kind of what's going on. Jim, are you up? Are you with us and ready to rock and roll?
I hope so. Can everybody hear me?
Jim's had some technical difficulties today, but that happens when a man lives in just Florida, Kentucky, and kind of around the world. We're just glad you're back with us.
So, all right, let's get this thing started. I've gotten a lot of private questions, and hopefully we can cover some of the things that are in there. There's a lot to cover with what's going on right now. So a little bit of background. Last week I gave you the picture, the one on the left. Let me turn on my highlighter here. Whoops, sorry. This one on the left, that was 2 weeks ago on August 2nd when we had our update. That's what I gave you. I commented on the oddness of the Northeast, which was the hotbed being yellow. The blue in the middle don't pay attention to because the blue in the middle, basically those counties are uninhabited counties. And the left and right coast, southeast, were all kind of sort of red. This one was, I pulled this last night. This probably changed by now, but I pulled this last night. And you'll notice that basically outside of outside of Nebraska, I do know my states. Outside of Nebraska, most of the states are very red. So that's the concern. Right now it is a Delta variant issue, highly, highly contagious, much more so than the original, much more so than the common cold. We talked about the CDC side of things the last time. I'm not going to get into schools. If your child's in school, check with your local. It's just all over the map right now. Technically speaking, I'm going to go to state right now so you can see it. Unless you're in one of these 7 counties that are orange and the one yellow in the entire state of Kentucky on the right-hand side. By the way, this is, the left is July 30th, right before our last presentation. The right is last night. So this is like up to date. I didn't grab this morning's. Technically speaking, in the red zone, there was a directive, and I don't believe it's been lifted, that says that you're not supposed to go to school, but nobody is following that right now. Again, this is the red zone recommendations. They don't want anybody gathering different things. This is the same one that's been in place since July. So if you're lucky enough to be in one of the 7 counties, great. If you're not, these are what you're supposed to be doing. So this leads to the questions everybody has about masks. So I want to give you just the update in the picture. You guys can see that for yourself. Here is where we are with the masks. So right before we had our presentation the last time on July 27th, the CDC came out with new guidance, and their new guidance was all public indoor settings. And on that call, I had all kinds of questions from people, or on that Zoom, we had questions saying, what is a public indoor setting? Does that include our work? Does that include, what is it? We still don't know. 2 weeks later, we're dealing with this Delta variant where it's so aggressive that the whole country's turning red. They have not explained what public indoor settings are. It's created a whole bunch of confusion. We don't know whether it applies to workplaces, but OSHA came in and said, now we're going to talk about it. So great. We all think that we've got guidelines from OSHA. Problem is, OSHA guidelines are a nightmare because of what they did and didn't do. So here's the thing. OSHA came out and said, our recommendation is for all vaccinated workers in areas of substantial or high community transmission to wear masks to protect the unvaccinated. And then it says if you're around COVID-19, then you should be quarantined or a negative test that's taken 2 to 5 days after contact. Now, we talked about this the last time as to what is a substantially high. I'm going back to this for a second so you all can see it. If you're in an orange or a red county, you are substantially high. Now, our state has a different way of calculating versus the CDC. If you look at the state of Kentucky, there is no yellow, there is no blue. It is all red. So according to the CDC, everyone in the state of Kentucky should be, back to this, whoops, wrong one. Everyone should be wearing masks if you're fully vaccinated in anywhere in the state of Kentucky to protect the unvaccinated. That's OSHA. This is a recommendation. So what's a recommendation from OSHA? You all have heard this from me before. A recommendation is advisory in nature. The problem with an OSHA recommendation, you have what's called, and I'm jumping down a little bit, a general duty clause. Under OSHA, you have a general duty to protect your employees from any type of danger known to you or a commonly known disease. Think of asbestos, black lung, different types of diseases that have been out there. It is your requirement as an employer to protect your employees from those known dangers. So while it is advisory, and it is, quote, intended to help employers and workers who are located in areas of substantial or high community transmission, they really didn't do anything but require it because of the general duty. But wait, it gets better. So what does OSHA say? Well, they come out when they have these orders that they come out with. They have an executive summary, they have the full body, and then they have an appendix. In this one, I don't know why this is so difficult. I don't know who confused this. I don't know why it says what it says. The executive summary literally says, quote, fully vaccinated people in areas of substantial or high transmission should be required to wear face coverings inside, period. That's the summary. The problem is this first bullet here. The recommendation does not appear in the body of OSHA guidance at all. So the executive summary is to summarize the OSHA guidance. The OSHA guidance itself does not contain any of those directives. Instead, the body mentions the CDC recommendations that you supply employees with face coverings, but it does not adopt the CDC guideline itself. So you've got a problem because the executive summary that you are allowed to rely upon literally adopts the CDC. The body of the text does not. But then it gets even more confusing. The appendix goes further, and this is what a lot of people are going to rely on. The appendix literally has a much narrower interpretation, and it states, and this is important, employers should take additional steps to mitigate the spread of COVID-19 among unvaccinated or otherwise at-risk workers due to the following types of workplace environmental factors, especially in locations of substantial or high transmission, pursuant to CDC. Then it says, what are those workplaces with a heightened risk of COVID-19 due to workplace environmental factors? They are manufacturing, meat, seafood, poultry, high volume retail, and grocery and agricultural processing settings only. So now you have an executive summary that says fully vaccinated people in areas of substantial or high transmission should be required to wear face coverings inside, period. CDC defines that as any red county or orange county. The body comes in and doesn't say anything, and the appendix goes further and says, no, those specific high risk are manufacturing, meat, seafood, poultry, high volume retail and grocery, and agricultural processing. In one document, all three are completely different. Then in the appendix, just to go further, it talks about general precautions, and what it says in the main guidance, it says you should require fully vaccinated workers in areas of substantial or high community transmission to wear masks whenever possible and encourage and consider requiring customers and other visitors to do so. But that's after they have defined those as manufacturing, meat, seafood, poultry, high volume retail and grocery, and agricultural processing. One document, three requirements, completely contradictory of one another. So, where does that leave an employer who is not one of the heightened risk industries? Meat, processing, poultry, agriculture. What about if you're outdoors? What if you only have vaccinated, not at risk, and you're not located in a substantially high or high community transmission area? It seems to suggest, believe it or not, because you don't look at the executive summary, you can if you wish, but it's not the requirement. The requirement is the body. The OSHA seems to suggest you're not required to do masks for fully vaccinated. And I know it's against everything that we just talked about, and I know it's against CDC, and I know it's against everybody's guidance right now. But OSHA is what you're required to do. However, CDC has not adopted this OSHA has not adopted the CDC. OSHA still has not defined what a public indoor setting is, even though in the executive summary, they've adopted the indoor setting language. And OSHA only uses the term, and this is for anybody who's worried about getting literally cracked down on OSHA, you can use this. They've only used the term public indoor setting with regard to public-facing workplaces such as grocery, retail, actual customer interaction, restaurants, and so on. OSHA does not reference employee maskings in the public indoor settings. It actually only includes customer recommended masking. So that just shows you how confusing this is from a legal standpoint. Again, I am all for trying to protect people and maintain from the variant, and if you're vaccinated, great. If you're not, then you need to make sure you're adequately protecting yourself. The problem is OSHA is the standard that all of you are supposed to be following, and right now, OSHA guidelines are really, really confusing. So it's left all kinds of questions other than, what do you do if you're not in a heightened risk industry? But like up here, all of these questions up here, they still exist, and there's no guidance for us right now on that. But when and where are masks required? So this goes back to the slide that, well, actually, it's not the slide. It was a polling question, and people were like, well, we're requiring it, but not at your own desk. We're requiring it unless you have your own cubicle. We are requiring it in a public setting. OSHA has not weighed in. CDC has said wear masks. They have not said in separate settings you can take them down. Cubicles, what if the cubicles don't go to the ceiling? All of these things were well established before, very well established when we went through this the last time. What you're seeing here now is like implementation of guidelines without the underlying meat to help you as an HR professional actually implement those guidelines. And it's very concerning, and there's not a whole lot of help. Here's the other one, and I got this in a private question. I said, stay tuned because we're going to be talking about this. What if an employer knows that employees at its high risk, so somewhere in Kentucky, at its workplace are fully vaccinated, but you don't know who may be at high risk? Can you ask them? The answer is probably not. If you ask an employee, are you at high risk? Or you have some kind of polling, are you at high risk? You can ask. Under EEOC, and we're about to cover this in a second, you can ask them if they've been vaccinated or not, because there's an exemption for the pandemic to ask that question because of the health and safety of other employees. But now, everybody says, hey, here's my vaccination card. Now, there's a problem because now there's a secondary fake vaccination card. People are out there with those vaccination cards presenting them as real. How far can you go? Can you demand a doctor's note? No, you can't, because we have directives from the federal government saying don't overburden the doctors with formalistic requests. Take what they've given you and believe it's true. Okay, that's great. So now you have a problem. Can you have fully vaccinated employees that you now know are fully vaccinated, but wait, are you at immunocompromised risk for the Delta variant and I need to protect you more? You can't ask. If you ask, you could have somebody literally go, yes, you know, I do have lupus and I'm concerned about being around people. Well, now you've now learned HIPAA protected and ADA protected information that you could be accused of utilizing against that employee that has lupus, that can't get the vaccine or can't get the secondary dose of the vaccine. It creates a tremendous problem because nobody has come in yet and said, you know what, we will allow you to ask the question so that you can protect the rest of your employees and that employee. So in essence, what they've done is this. You must assume all of your employees are at risk, even if they're vaccinated. So basically, you must assume and then start putting on masks everywhere. Why? Because you know the Delta variant is going after people who are vaccinated and unvaccinated. That's not a political statement. You know people who have been vaccinated are susceptible to getting the Delta variant. You know you can't ask everybody, are you at high risk? So you as an HR professional must treat all of your employees as being at high risk and start treating everyone as susceptible. That means, in essence, in order to protect yourself, you go back to OSHA saying everyone should be vaccinated to protect those that are not, and an indoor setting is a public setting, and the general duty clause, technically speaking right now, everyone should be masked, even though the executive summary with the body with the appendix are not in agreement with one another. Technically speaking, everyone knows that this is a risk, and everyone knows that people who are immunocompromised are going to be at risk for more susceptible problems. So I know this is like a nightmare, but that's where we are right now, and I've had a lot of companies ask me, so should we just start going back to remote? And the answer is probably. If you have any ability to take people back to a remote setting where they're working out of their home and you go back to Zoom meetings and you don't have people in the office, in order to fully protect yourself as an employer, not even looking at your employees, you may want to very seriously consider that until the impact of the Delta variant is fully covered. So the next thing, and I got asked this in a private inquiry as well. So what can we do? Can we encourage and mandate? And you've seen enough that you know you now can. You can mandate vaccinations. You can fire people that haven't been vaccinated. You can preclude people from coming on property if they haven't been vaccinated. You can do whatever you want to do, subject to disabilities under the ADA and religious beliefs. I had someone ask me for private legal guidance about whether their child who is playing college level athletics could refuse. And I said, it depends. What is the directive from your school? Because you're under a scholarship, the school gets to control that. If the school's making it voluntary, then you have a choice. If the school doesn't, you may not have a choice because you're there on a scholarship and it depends on the contract you signed to receive the monies you received. So this is a really difficult issue, but the EEOC is confirmed as long as it's not, oh, by the way, the end of that story was the athlete said they were going to declare a religious belief based upon my incredible guidance I gave you all earlier, which is religious belief is the presence and or absence of a belief, the presence and or absence of a particular religion, the presence or absence of it's a presence of a firmly held belief of any kind of religious or non-religious enforcement. In other words, if you firmly believe you shouldn't get it, you can pull a religious card and not get it, and there's nothing anybody can do. Under current EEOC, religion is basically an individual, not a corporate belief. So it's not Presbyterian, Catholic, Methodist. It's the individual's firmly held belief, and it doesn't even have. They could say, "I'm Catholic. Catholic Church doesn't buy this, but I do, and I won't take it because of my firmly held Catholicism." Sorry. And so that's literally a bizarre exception, and it can be very widely held. ADA as well, you can't follow up with a whole lot of questions. If they say, I have a disability that precludes me from taking it, you can say, thank you, I don't have any other questions, but you must protect yourself and so on. So, except for Montana, you can have policies that distinguish between vaccinated and unvaccinated employees. Again, subject to medical or religious requests. I've been asked, can we have bracelets? I've been asked, can we have green versus red versus yellow? And the answer is yes, with an exception. You cannot force someone to wear the bracelet if they do not want to wear the bracelet. You can force them to work from home, but if you force someone to wear a red bracelet or red lanyard or red shirt, you could be forcing that person to divulge or making them uncomfortable about the possibility of divulging a disability that you cannot force them to disclose. So yes, you can have bracelets, but you must be very careful with how that policy is written because you can't preclude people who, and that includes the green, because vaccination status, they may not want people to know they've taken the vaccine. So they can wear green even if they're unvaccinated and lie about it. and what proof can you ask for? We've kind of gone through that. It's really difficult to force anything beyond, here's my vaccination card. Why don't you have one? You can't really ask me that. I might have a disability that then discloses. So there's a whole lot of confusion right now. So the next thing is, and this goes back to Lyle's comment at the beginning, you can require unvaccinated employees to test themselves weekly or even more often. And the new guidance for you is you can actually require your employees to be responsible for the costs of getting those tests. That's new. That may change under some of the newer guidance from the federal government under the infrastructure that we're about to cover. And under the $4 trillion reconciliation bill, but you can actually require them to pay the cost of their own tests, subject to minimum wage, and that goes just, and we talked about this like a year ago. If you require your employees to wear steel-toed boots, to get tested, to out-of-pocket costs of any type, you can deduct that from their wages unless you're in Indiana, which doesn't allow it without certain authorization every single time you deduct. And there's a few other states like that. But typically you can deduct it as long as they never dip below minimum wage. So if the shoes cost you $100 in the first week, they only made $150, and by taking this out, you would drop them below minimum wage for the hours worked. You cannot deduct it that week. You have to wait until the following week. Same thing with the cost of these tests. If you require them to take it and you administer it to them, and it's not free. You can limit access to company property. You can limit access to company-sponsored events. You also can offer paid quarantine leave to vaccinated individuals, but not to unvaccinated individuals. Now, this accepts and exempts anything that you have under the EFMLEA. If you're required to give leave, but if they've exhausted that leave and you want to voluntarily add additional, you can start to treat them differently. This may change in the upcoming weeks, depending on the $4 trillion spending effort that's out there, because there is an effort to try to extend everyone's unemployment, to extend the federal unemployment as well, to extend the COBRA coverage, to extend everything under EFMLEA. It's all up in the air still. But right now, you can treat vaccinated differently than unvaccinated. Some people are starting to add the health coverage surcharges. You can do that. It's like smokers. Smokers, you can add $20 to $50 a month. You can do that to unvaccinated because it is increasing the costs of your health insurance as an employer, and it is also increasing the amount of time off that people are requiring. So you can do that if you wish. Keep in mind that may affect, and this is one of the questions I got from someone saying, how do we protect against the us versus them type concerns? The answer is you can't. If you're doing this and you start offering incentives or punishment, you're going to create an us versus them. You're going to create a vaccinated, unvaccinated, and you're going to have morale issues with your employees. So you need to really gauge your employees. You need to understand the possibility of people quitting, refusing, being angry, looking for jobs elsewhere. You also must look at this second bullet. If you're not careful with how you do this, if you don't properly plan, if you don't get guidance from your insurance carrier, your legal team, or something else, you may well actually accidentally create a program that comes under HIPAA's wellness rules. If you do that, you have to comply with all the wellness rules that we covered like in April or May of this year, maybe a little earlier. So a little hint, you can go back and find which one of our slides talked about the wellness rules, and you may want to contact your insurance company to find out, hey, if we start charging a surcharge, does that bring us under the wellness rules of HIPAA? So this last one is just a little reminder. Some people are saying, hey, I'm just going to take money out to cover the penalty, this $20 to $50 a month. I'm going to deduct it from pay if they are not vaccinated. That would, in fact, in 99% of the time, be an improper deduction. and you could find yourself on the wrong side of employment laws and wage and hour laws. So don't do that. Handle it correctly. Make sure you're not just halfway doing it. All right, so a couple of other updates before we get to the chat. Number one, July 26th, IRS came out with a new notice providing additional guidance on COBRA subsidies under the American Rescue Plan Act, which was adopted back in January. It updated the May 18th notice. There's not a huge thing in here, but there are a few little things you just need to know about. It is available even if the initial qualifying event occurred prior to April 1st. We had some questions when this first came out. People were saying, what if this occurred prior to April 1st? Do they get to extend it? The answer is yes, now under the brand new guidance. It also clarifies that eligibility for any other group program nullifies the COBRA subsidy, and it does not matter whether those other coverages are identical or provide the same amount of coverage. So if there's Medicare coverage, but it doesn't cover as good of a plan as what you had on COBRA, you don't get to just pick and choose and ignore Medicare or any other coverage. If there's anything else, you're now disqualified. The last thing is common law employer was fully defined, and if you're in one of the joint employer situations, like you're a staffing company or you have people working at someone else's facility, it did go into a lot of detail. I know that that applies to some of my clients, but it does not apply to a lot of people on here. So I didn't waste slide space on a common law employer for a joint employer situation. If you need that, pick up the 2021-46. It describes what does and does not apply. So, last but not least, what is this infrastructure bill? It is not the $4 trillion reconciliation bill that can come through with a simple majority vote. This is an infrastructure bill. It was supposed to be roads and bridges. It does include $1.2 trillion for the building and repair of roads, bridges, ports, airports, public transit, broadband, and power grid modernization and other projects.
Woo!
It also includes, if you're interested or if this matters to you, certain green initiatives with regard to electric vehicles, alternative fuels, carbon recapture, and other things. What's not in the bill for businesses and employers is what's important. It does not have the PRO Act. That was the, if you recall me talking about that, it was the pro-unionization effort. It had to be pulled in order to get past the filibuster rule, to get past some of the other concerns. So they pulled back on the pro-union, anti-business, that's just what it is, act to bring in later separately. So the PRO Act was withdrawn. It also does not address the paid leave, child care, Medicare expansion, unemployment insurance reforms, and other social infrastructure. That's the one that I'm telling you, stay tuned, because it may come in under the $4 trillion. Although Senator Manchin from West Virginia has indicated he will not agree to all of the $4 trillion. In case you didn't know how many zeros there are in $4 trillion, it's 12 zeros. I looked at my bank account and I seem to be missing several of those zeros, but that's a whole lot of money. Our total deficit, or I'm sorry, our total national debt, I believe 4 years ago was 19 trillion. So 4 trillion is a lot of money. So these issues, the social infrastructure issues that are affecting you with regard to COBRA extension and several other factors that are supposed to expire soon are being debated right now, but they are not part of the $1 trillion. So any of your employee protections, EFMLEA, COBRA extension, so on and so forth, are not part of this $1 trillion, $1.2 trillion. Also, this little nugget hasn't been talked about at all, but you just need to know. Right now, the employee retention tax credit that was established under CARES, extended under the American Rescue Plan, is supposed to terminate on October 1st. So keep that in mind. I suspect that will change before October 1st, but that's the current status. Meanwhile, this one down here is something that all employers just need to keep their ear to the ground and listen to. The pregnancy accommodation bill. It requires accommodations such as more frequent restroom breaks, nursing breaks, pump nursing for anyone who has that, more frequent breaks than other employees, and several other accommodations. It went through the Senate subcommittee, the Health Committee, Health, Employment, Labor, and I don't remember what the P stands for, but it went through a 17-2 vote in favor, so it's overwhelmingly receiving support from both sides. I suspect that will be adopted, and you need to be ready for that. So that's the end of the slides. What I do want to say is, first of all, there are your codes. The OSHA, I didn't see a question, but this is probably one that everybody's wondering. The emergency temporary standards that got mothballed were mandated to be done back in March, April, May, August. They've not yet been done. I suspect with the variant going forward that the OSHA emergency temporary standards will be coming out any day now. That will change everything, because that will be along the lines of the asbestos, the black lung, where they came out with an emergency. You must comply immediately. There is no public discussion time period. It is literally an immediate enforcement requirement of all employers. So if you hear ETS or OSHA ETS or emergency temporary standard, you need to pull it out and look at it, review it, and make darn sure you immediately comply. I did have a slide about the number of OSHA complaints and retaliation complaints. I ended up deleting it, but just so you know, there are over 6,000 active OSHA complaints about retaliation for COVID whistleblowers. There are additionally about 2,500 state-based OSHA, so KOSHA in Kentucky, based complaints with regard to retaliation for whistleblowing on OSHA. So the downloading of presentations, absolutely, they're both on our website and on the Hanna Resource Group website. Every single one we've ever done back to the beginning of time are listed there, including the videos from all of those presentations. Give us a couple of days to make sure we can upload those, and hit me with any other questions that are up there, anybody else that they want to throw one out there, and I'll try to answer them as I go. Whoops. I'll put that back. Well, I think I stopped it. So am I still screen sharing? Nope.
It's just your, whoops. Okay. Oh.
I just shut it down because I don't know what happened, but my screen went away.
Yeah. Okay. Allison, I see one question out there. Do you see some?
Yeah, we've got two questions. Well, let's work backward. Are peaceful protests or walkouts, RE vaccine mandates, if done during unpaid lunches, protected as concerted activity?
You know, that's like getting combined with union protections and COVID protections. The short and simple answer is probably, because especially if it's on their own lunch break, you can't control them. It's considered water cooler talk, and they're allowed to do it. Even more, I think if there's a vaccination protest, I'm assuming that's against vaccinations, I would stay clear of trying to discipline people for vaccination protests. I would enforce your rules the way you need to, but don't get into the game of going after people for raising concerns. People have legitimate concerns. It's not that I would not get there. If I were you, I would not discipline people for going out on their own lunch break. If it's on your time, you can control your time and make them come back to work. If it's on their time, leave it alone. General unionization guidance there. not really COVID specific, but people have a right to protest whatever they want, and that's one of the things they can protest.
Okay, if employers mandate the vaccine and an employee has an adverse reaction, can the employer be held liable?
Yes and no. Typically, those are workers' comp. The government has not, and I know we researched that once before. I don't believe the government has come out with any protections for employers. It would be a smart thing if they wanted to mandate vaccines, but actually, I think I need to backtrack because I recall one small thing. Whoops. Sorry. Okay. I recall one small thing several months ago where we talked about something the EEOC put out or the CDC that was supposed to provide some level of immunity to employers for vaccines. But I don't believe it went far enough that I would tell you, sure, you don't have to worry about it. In fact, there is protection in the new 1.2 trillion for people who need additional time off for getting sick during the vaccination period in order to try to encourage people to get vaccinated. I don't have the details on that, so I'm not prepared to go into detail on that. You'll need to get some legal guidance on that.
Okay. Are newly hired employees eligible for FFCRA time if we voluntarily chose to extend the FFCRA?
I believe so, but that's really down in the weeds, so I can't verify that. I haven't looked at the FFCRA since January, and before that I hadn't looked since like August. So I believe so under the ARPA, the January 2021 extension. I believe if you voluntarily extended it, it can apply to newly hired as well, but you would need to verify that yourself.
Okay.
And I saw the one on the bans on mandates. Employers can still impose a masking requirement as long as you're not exceeding the authority of the mask ban. I don't believe that any of the mask bans said that a private employer could not continue their mask mandate. I think it's going toward Florida, Texas, and a few other states that have banned mask mandates. Those mask mandates are by public institutions, meaning schools, localities, governmental entities. I don't believe any of those anti-mask mandates said private employers cannot, or private individuals in their home or otherwise cannot enforce a mask mandate. So I don't think that if you as an employer want to tell an employee that's going to Florida, you must wear a mask at all times you're doing work for us, you can still do that. I don't believe there's anything in the state, and if they did, I could see that becoming a lawsuit very quickly because they can't control private employers any more than OSHA. If you remember with this ETS, I've told you for 6 months, 8 months now, since that directive came out, I was going to be very interested in seeing the ETS because OSHA and the federal government cannot issue mask mandates. So OSHA doing it under the emergency temporary standard would create a whole lot of litigation. Same thing on the other side. The government can say, government can't issue mask mandates, local schools can't issue mask mandates, and I'm only talking Florida and Texas and a few others, not Kentucky. But they can't turn around and say, and if you do, private employer, we're going to punish you. They can't, because you're a private employer. If you want to say to your employees or your customers or anything that we won't provide service to you unless you wear a mask, you can do that.
Great. All right, I think that's all of the questions that we have.
I have one for Joe Bon Jovi. I'm assuming that this background is not of your Frankfurt facility, or else you brought in some palm trees for the Frankfurt facility.
That's our Sazerac house in New Orleans. And,
yeah, I know.
I highly encourage everyone to go visit when they have the opportunity. Post-COVID, of course.
And if you haven't had a chance to have a Sazerac, the actual drink, you should treat yourself to one. It's the very first cocktail ever made using our Kentucky bourbon in the great location of New Orleans back in the day. So that's my history lesson on bourbon.
All right. Well, the floor is open. If there are any other questions, we certainly take them. We got through this in a record time. Good work, Jim and Joe and John and everybody else that helped make this happen. Allison, Kendra, and Casey and Autumn behind the scenes. Thank you. Any final questions, comments, or thoughts? All right.
There's one that just came out. Any guidance issued on business travel? Yes, there is. There was some guidance both internationally and nationally. OSHA had a little comment on it in their updated guidance, and then the CDC has quite a bit. The recommendation is that you require people to wear masks. Go back to the OSHA standard. Require people to wear masks in any area that is high or substantially high, or around anyone that is susceptible to COVID. It really didn't say a whole lot. Now, international, there is still a lot of restrictions on going into the United States from any other country. Quarantine, negative testing before you come, things like that. So there's a lot of questions, or there's a lot of things on that that you may want to check out on the CDC. There's still travel restrictions internationally and so on.
Yeah, and I've talked with an employer that has a different standard in the US, but if you're traveling internationally, they insist that you get the vaccine before you go, just to try to keep people safe. So some people are setting some different standards for international travel or travel outside your home area. All right. I'll open up the mics if people want to speak up now. I never get anybody to do this. There are not many people, but I enjoy it when you do speak up. So, well, thanks for keeping up with us. We're going to watch what's going on out there in the public. And if we need to meet again, we'll be letting you know. Sure appreciate having everybody with us. Let's see. Oh.